Tardive Dyskinesia. Hi!
What is tardive dyskinesia? Tardive dyskinesia or TD is an involuntary neurological movement disorder caused by the use of dopamine receptor blocking drugs that are prescribed to treat certain psychiatric or gastrointestinal conditions. What are the causes of TD? It is a long-term use of certain drugs which produce biochemical abnormalities in the area of the brain known as the striatum.
The patient suffering from TD doesn't have to experience all the symptoms and signs. Only one sign is enough to diagnose a person with TD. So let's see the signs that might indicate that a person has tardive dyskinesia. They might experience facial grimacing, finger movement, jaw swinging, repetitive chewing, and tongue thrusting. This might cause pain to the patient due to the sudden movement of muscles. Each sign is divided into 4 stages, depending on the severity of this particular sign and the rapidity of the movement.
Now, let's have a look at pathophysiology of tardive dyskinesia.
The main cause of TD is the blockage of dopamine receptor or transporter whenever taking of excessive drug molecules in a longer period of medication. The presence of drug molecules will bind to dopamine transporter and the dopamine stay in the synaptic cleft longer, thus cause overstimulation of postsynaptic membrane. Consequently, the nervous system will react and adapt to it by upregulate or downregulate to meet the normal function of the immune system and basically the homeostasis. This process is called sensory adaptation, and drug resistance is one of the adaptation that is the reduction in effectiveness of a medication.
These are the similarities between TD and Parkinson. These are the differences between TD and Parkinson's disease.
So, how to prevent tardive dyskinesia? First, stop taking antipsychotic drugs because it requires careful evaluation of indication and risks. Second, metoclopramide should not be used continuously for longer than 3 months. But for those TD patients, what kind of treatment they receive? First, consumption of clonazepam. Second, we also have traditional herbal therapy, which is ginkgo biloba. And lastly, don't forget antioxidant medication and supplements such as vitamin E.
Tips for helping tardive dyskinesia patients. Patient itself. Psychotherapy. Patient meeting regularly with therapists, and this can help patient to deal with social and psychological consequences of the illness. Psychotherapy is equal to valuable ally of conventional drug therapy. Behavioral therapy. Patients should stop consuming antipsychotic drugs with supervision from therapists. They also need to try to adapt in the environment by involving in social activities, and the last one, they should try to practice newly learned social skills outside the therapy session. Parents. Parents should give moral support and attention, be alert to the changes of their behavior, try to understand their feelings as they are very sensitive, and give advices and guidance to them to be as strong as they can. Friends. Friends come after family. They should give 100% support and never bully and betray their friends who suffered TD, either in verbal or physical form.
Islamization based on Surah Al-Baqarah, verse 219. Medicine indeed help us to recover from disease. However, after long-term consume the medicine, it may cause side effects such as it can lead us to TD. Although not all medicine can lead to TD, but the medicine itself has side effects if we do not use it according to its doses. That's all from us. Thank you!
Created using Powtoon.